Hey guys, this is Dr. Today we'll look at the pellagra. The pellagra like symptoms, and we are looking at the conditions which are associated with this. So begin with, first is the heart-nerve disease. So in terms of the heart-nerve disease, the reason for the niacin deficiency is the intestinal. It is intestinal and the renal malabsorption, intestinal renal malabsorption, and this will be of the tryptophan. So heart nerve is the tryptophan. Next is the carcinoid syndrome. So there is presence of the carcinoid syndrome. In the carcinoid syndrome, there is overproduction of the serotonin. So there is overproduction, and this is of the serotonin. Is overproduction of the serotonin, and this causes the diversion of tryptophan. There is diversion of the tryptophan. Diversion of tryptophan from the NAD plus pathway. Next, we look at the vitamin 6 deficiency. So in terms of vitamin 6 deficiency, there is a defective kynurenase pathway. There is a defective kynurenase pathway, and let's look at maize. In terms of maize-rich diet, so in maize-rich diet, what is there? There is a niacin is available, in unavailable niacin form. So niacin, if you see, it is unavailable. This is in unavailable niacin form. Next, we have the jowar diet. So what happens in the jowar diet? So the jowar diet, it is the sorghum, and here there is an increase in the leucine content. There is increase in the leucine content. And this inhibits, what this does is it inhibits the QPRT enzyme. QPRTase enzyme.